the anthroposphere diameter of the true acetabulum?
Yes, we have to, the true acetabulum was less than 40 millimeters, so we don't have this cup. This was one of the constraints to do this at the true acetabulum. But my approach was a bit different. We know that the debate is about anatomical hip center or hip center, but I can call it now an adjusted hip center. What's the problem now? We took a Ranawat method. We know the isosceles triangle, the famous Ranawat method. It starts from the teardrop and to draw the height and the lateral distance of the acetabulum, but it does not take into account the global hypoplasia of the hemipelvis. So what I do, that I do the Ranawat method again, but taking into account the global hypoplasia of the true pelvis. So the acetabulum will be the second fifth of the whole 5 subdivisions to divide the whole distance to 5 increments. So 20% of the height of the pelvis is the acetabulum, and it started after the first 20%. So when I calculated this, the hip center for this lady was truly above what is her DDH or dysplasia location tells you. So in the Ranawat method, they don't take the account of the pelvic obliquity, and they start always through the teardrop. But what we do different, we start after 20% of the whole pelvic height to get in account the whole problem of the pelvic hypoplasia. So this is what we calculate, and this is the if you calculate it from the contralateral side, if you are having a normal side, this is the adjusted hip center, not at a lower level, and obviously avoid by this the extra lengthening